As we roll out this vaccine, we need to make sure that everybody has access to it. It's very important for every resident in a country to have access to the vaccine, irrespective of their status. Right now, for example, Jordan is making a priority to vaccinate Syrian refugees in Jordan and not only its citizens. So it's very important for every country to reach out to the vulnerable population in their own community and ensure they get a chance to get vaccinated and they receive the vaccine in order to reach that herd immunity that we all desire, 80%. Otherwise, the virus is still circulating in our own communities and may mutate, and the vaccine may not be effective against it. So for our own interest, for everybody's interest, everybody should get the vaccine, irrespective of their status, and nobody should be left behind. Delays in vaccination have occurred in many countries, including the US. So it's very important for us to understand where the problem is. Is it simply a problem of logistics? We're not able to send the vaccines to places, or we don't have enough people to vaccinate, vaccinators, or places to deliver the vaccine, or the public is not willing to come and take the vaccine. Because each one of these problems would require a different solution. And unless we understand what the problems are, we cannot fix it. And then we need to keep in mind that we need a national plan. Every country needs a national plan to deliver the vaccine, but also that plan has to take into account the localities. Public health is local. Vaccines will be given at the local level, and we need to understand the capacity of the local level, the issues that they will face, and we have solutions for them. And we need to work with them in order to ensure everybody has access to the vaccine. Otherwise, we will not reach that herd immunity. To solve a problem, we need to understand what it is, where it is happening, and devise a solution for it, and make sure we involve the local community in order to vaccinate the public in that community. IHME's COVID-19 projections show that a fast vaccine rollout has the potential to save many lives globally. A fast vaccine rollout will also help us to go back to normal lives much faster. To date, delays in vaccination have occurred in many countries, including the United States. Intensified efforts to ensure faster delivery are critical to slow the course of the pandemic in the coming months. As vaccine rollout gets underway and delivery issues are resolved, it's very important to monitor attitudes toward the vaccine and address population where vaccine hesitancy is high. For example, in the United States, 52% of Americans said they are willing to take the vaccine, while 24% said they may. So it's very important for all of us to have an education campaign targeted to the subgroup of the population who are currently not willing to accept the vaccine. This information needs to be disseminated quickly so that by the time the vaccine is available, the vast majority of the population are willing to receive it. As many countries are rolling out the vaccine right now, it's very important to remember that many countries don't have the capacity to vaccinate their public or haven't started their vaccination campaign. It's very important for all the rich countries, once they vaccinate their public, to pay attention to poor countries and help them to make sure they vaccinate their public as well. It's very important for all of us because this virus could be circulating elsewhere and we may have a new strain or a new mutation. And it will come back and hunt us and we'll start all over again. A good example is what has happened right now in South Africa. We have a new mutation in South Africa that's concerning because the vaccine may not be as effective as the mutations that are circulating in the United States or in England or elsewhere. So it's very important for rich countries to help other countries as well in order to get rid of this virus and reach a global herd immunity and not herd immunity in one country, because it's a false sense of security. If a country reaches a herd immunity and its neighbor hasn't, it's not going to happen within your country. People are going to move around and the virus will start circulating all over again. And worst case scenario, it could be a different type of the virus circulating. So we need to help each other. We're all in it together, and it's the time to help each other in order to vaccinate the public to move forward. What we know about viruses, they do mutate, and they mutate a lot. So far, we are aware of several mutations from COVID-19. Some of them are homegrown here in the United States. Some of them happened elsewhere and they came here, the UK version lately, for example. We're aware also of a South African version that we are concerned about, that potentially the vaccine is not as effective against it, like what we have seen with other mutation of COVID-19. So it's very important for every country in the world to have a plan for genomic surveillance, to know what's circulating at home and elsewhere. Once we reach a herd immunity here in the United States or in many Western countries, it's also very important to do so in other countries because they have not reached a herd immunity and the virus is still circulating in these countries. And we need to know what type of virus is available there or circulating before it comes to our own countries. Again and again, it's very important for all of us to work together, vaccinate everybody, every country in the world, and also at the same time do genomic surveillance to make sure what kind and what type of mutations are happening elsewhere in order to be ready for it here at home and elsewhere. We're in it together, and working together is the most important thing. We cannot approach solving COVID-19 pandemic from a single country approach or a single state approach. We need a universal plan in order to make sure nobody is left behind, everybody is vaccinated, and we're aware of what type of mutations are occurring anywhere in the world. Otherwise, we're all at risk and nobody will benefit unless all of us are benefiting.